Hello, everybody, and welcome to the event. We're going to just take a moment to let Zoom load everybody. Hello, everyone, and welcome to Countering COVID-19 Misinformation, the Impact on Healthcare Providers. I'm Carmel Shachar, the Executive Director of the Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School. We are delighted to invite you to this very important conversation talking about how the pushback on COVID-19, specifically vaccination and good public health practices, has really impacted the working lives, the private lives of healthcare providers. This is going to be a moderated discussion, so we strongly encourage you to submit questions. How do you submit questions, you may be asking? You can do so in two ways. You can use the Q&A feature through Zoom, which if you go down to the bottom of your Zoom window, you should be able to see that. Submit your questions there. That's probably the best way. Or you can join the conversation or submit questions on Twitter at Petrie-Flom using the hashtag #AgainstMisinfo. Again, that's hashtag #AgainstMisinfo. Petrie-Flom staff will see your question and pull it into the Zoom Q&A queue. Some ways that you cannot submit questions, please don't try to use the Zoom chat. That's not a way to submit questions, as well as the Zoom raise your hand feature is very cute, but we will not be monitoring that. If you have any technical issues, please email us at petrie-flom@law.harvard.edu, and we will jump to try to solve your issues. If you really enjoy this event, you might be interested in some of our other upcoming events. We've got a really robust event calendar looking at, for example, the Mexican government's efforts to curtail gun violence. You should sign up for our newsletter. It comes out only twice a month. We don't clog your inbox. You can do that on our website. We strongly encourage you to read our blog, The Bill of Health, which continues many of these really pressing, interesting health law and policy conversations in depth there, as well as just check out our events page to see what else you might like to attend. With that housekeeping out of the way, I want to introduce our moderator who's going to guide us through this conversation. He is Stephen Wood, who is a visiting fellow at the Petrie-Flom Center, as well as an acute care nurse practitioner practicing emergency medicine in Boston, Massachusetts. So he's very much been on the front lines of the COVID-19 pandemic. Stephen, I'm delighted to introduce you and delighted to hand over the event to your capable hands.
Well, thank you, Carmel, and welcome everyone to today's event, Countering COVID-19 Misinformation, the Impact on Healthcare Providers. The fact that we are still doing these programs virtually speaks to the impact that COVID has had on all of our lives, and especially on those of us who are healthcare providers, but also the general lay public, parents, teachers, people that are studying law. This has been a real journey for all of us. So I welcome you. Thank you for joining us today. We have a wonderful panel of experts. We reached for the stars, and we're very lucky to have some of the top people on this topic. That's an important one to all of us. I'm going to introduce them each, and then we will spend a little time getting to know them and having them have an opportunity to talk about the impact of COVID on their lives and on their practice. And then we'll return and we have some questions that have been both pre-developed as well as some questions that we'll field from the audience. So first, I'd like to introduce Robin Cogan. She is a nationally certified school nurse. We also have with us Dr. Shikha Jain, who's an assistant professor of medicine in the Division of Hematology and Oncology at the University of Illinois Cancer Center and the CEO of Impact. We also have Susan Benesch, who's the director of the Dangerous Speech Project and a faculty associate at the Berkman Klein Center for Internet and Society. So welcome to each of you. I'm going to open the floor first for Robin Kogan. And I know you have some slides to share with us. I'm going to give you each about 5 to 7 minutes to chat, and then we'll reconvene for a group discussion. So Robin, I'm going to give you the floor from here.
Terrific. Thank you. Let me just pull up my slides. So thank you. Thank you for having me and giving voice to school nurses. This is such an important topic for all of us. And I hope to share some real school level issues that are going on in schools really across the country. So my name is Robin Kogan, as I said, and I am a school nurse on the front lines of COVID-19. I serve the families of Camden, New Jersey, and I have been there for 21 years. I also write a blog called The Relentless School Nurse, and I've spent much of the past 24 months amplifying the voice, the work, the challenges, and the triumphs of school nurses across the country through my blog and through media engagement. I actually view media as part of my school nursing practice, and I use it to educate the public on the importance of having a school nurse and a school nurse team in every building. I've also used social media platforms like Twitter and Facebook to share evidence-based information with my colleagues, with my families, with my school staff. I don't engage in Twitter wars, but I am present on Twitter, and I have a following of more than 10,000. My blog posts have been read and shared more than 300,000 times over the past few years, and I do what I can to boil my part of the public health ocean in the fight against COVID misinformation and disinformation. This is what we feel like as school nurses. Every day, almost 96,000 school nurses serve on the front lines of COVID-19 in schools. It has been the most challenging time of my 37 years as a nurse, 21 as a school nurse. There are 56 million children in our country, and I'm not sure if you're aware, but 25% of our nation's schools have no school nurse at all. 35% only have a part-time school nurse. That's 60% of our schools. And the remaining 40% may have a full-time school nurse, but our ratios are untenable. For example, I've been a preschool to 8th grade school nurse with 900 students and 150 staff, and I was the only school nurse in the building. It is not unusual for a school nurse to have 1,000 to 2,000 students by themselves with little support. And this was a pattern that existed much before COVID and continues today, even in the midst of the pandemic. So when COVID did rear its ugly head and school nurses took on the challenges of contact tracing, isolating, quarantining, testing, educating, and truthfully, we became the de facto health departments, this was on top of our already untenable workload. And the pushback came back fast and furious from parents who thought we were doing far too much when it came to quarantining close contacts or sending students with specific COVID-compatible symptoms home. And that includes teachers and school staff who actually felt we weren't doing enough. But we are the public health professionals in buildings. And if your school is lucky enough to have one, but we're also the ones that were tasked with calling parents, with providing information that was going to further disrupt their lives. And we have been at this for 2 years. 3 school years have been impacted by COVID. So no wonder nerves are frayed. But that does not excuse the incivility and the sometimes hostile work environments that have resulted from what I believe is a combination of misinformation and clearly disinformation. Schools have become ground zero of COVID-19 to COVID-19 reality and the outrageous misinformation. Up on the left is an anti-mask group that calls themselves, interestingly enough, pro-science, pro-safety, and pro-smiles. Anti-masker attacks and even attempts to overthrow school districts over COVID restrictions include far-right extreme groups that are taking up their cause, even running for school board offices. And many school board meetings have seen an escalation of protests, negative comments, and even threats of violence. And naturally, this will flow right into the school nurse's office. The deep divide about implementing public health mitigation strategies like masking, one of the few tools we have at our disposal, has created disrespectful, rude, and sometimes angry responses by parents whose child is either symptomatic or has had an exposure. Sometimes these calls end with a parent hanging up on the school nurse. School nurses have been directed by parents to never call them again. One example of an abusive action was the parent on the left who created a vile t-shirt for her child to wear to school the day they returned from their quarantine that read, "My school nurse has blank for brains. I don't have COVID." That was on the back. Another example, it took courage and a sense of duty for one Vermont school nurse to call out a school board member who went on a tirade after the school board member's son violated the COVID quarantine rules. As a consequence of violating the rules, the student was not able to take his SATs because he was not allowed in the building. The father became enraged and belligerent at the ruling and threatened bodily harm and loss of jobs to the employees. The nurse went to the school board meeting and said, "This is what's happening. This is what this father said. Quote, I'll have all of your jobs. And quote, I'm going to hang you." It was the second time this year that the father had threatened the health services team. And because of all of this, since October of 2020, I began to hold school nursing support groups. They're convened via Zoom, and they have provided the privacy and safe spaces for school nurses to share real-time experiences, what it feels like to be on the front line of COVID in the school setting. And truthfully, the results are troubling, as school nurses have been bearing the brunt of politicizing public health strategies as they play out with parents' refusal to comply, let's say with indoor masking, a less than robust response to COVID vaccinations in some areas of the country, intimidation, bullying regarding quarantining, and general lack of cooperation with contact tracing protocols. After 16 months of these ongoing support groups, more than 100 hours of these groups with hundreds of school nurses, it's revealed a snapshot of a beleaguered workforce that is questioning our fortitude. I don't record the sessions or take names, but I write down anonymous quotes that illustrate the depth of the moral injury that's being experienced. Here's just a few examples. Well, here's one. I've been a nurse for 24 years and I've never felt more demoralized, questioned, or made to feel incompetent. I feel put in the middle of everything between parents, administration, teachers, and pediatricians. I am done with people fitting the guidelines for their own narrative. I have been a nurse for 17 years and this might be my last. You get the idea. So this is an actual picture that a school nurse shared, and this made her day. One of the students made this for her, but look what the little girl said. "Best nurse, thank you for helping our school stay safe." And that's what we do. That's who we are. So, but we've reached a tipping point. School nurses are taking stock of these extreme circumstances we find ourselves mired in. We're having brave conversations about self-preservation. And this now includes resignations, early retirement, even medical leaves. All truthfully are understandable, but they leave schools scrambling to fill unfillable positions. COVID has laid bare what we all knew was always below the surface of our profession, a stark lack of infrastructure that could easily come crashing down like a game of Jenga. The National AAP just updated their school guidance to include a statement about school nurse workload. And when national partners make these declaratory statements in support of school nursing, that is one step in the right direction. On the right here, you'll see the Washington Education Association was compelled to issue a public advisory asking the public to support school nurses. So how can we save ourselves, our workforce, our beloved profession? Truthfully, the first step is listening to us. School nurses have answers to save ourselves and in turn, our school communities. Thank you.
Thank you so much, Robin. And the work that you're doing is wonderful work. I'm sure that you've impacted many school nurses. I'm sure you've impacted many students, and your efforts to keep everyone safe is so greatly appreciated. And I'm looking forward to when we return back for some questions. I'm going to move next to Dr. Shikha Jain. You take care of some of the most sick among the sick, dealing with patients with oncology and cancers. I'm sure this is a patient population who requires our utmost attention and protection. I'm going to now turn the floor to you to discuss some of what you faced as a medical provider during this COVID pandemic.
Thank you so much, Stephen. I appreciate that introduction. And Robin, before I start, I want to say that I echo Stephen. And I actually just an hour ago had a conversation with our school nurse because my daughter called because she hurt her foot at school. And I have to say, I have 3 kids and I have such a huge appreciation for how the school's nurse has been able to keep our kids safe and in school when it seemed like it was not going to be possible. So huge thank you to you and all the school nurses out there who really are protecting our most valuable people, our kids. So thank you for that. So I actually wear a lot of hats. So as Stephen said, I am a medical oncologist at University of Illinois Health System in Chicago. And so I do deal with a lot of misinformation, disinformation from patients in person. And on top of that, I actually wear several other hats, one of which is I am the CEO and one of the founders of an organization called Impact. And I'm going to talk a little bit about Impact today because I think it directly impacts how I engage with my patients. I don't have any pretty slides like Robin did, so you're just going to have to hear me talk. But basically what happened at the beginning of this pandemic is myself and several other healthcare workers realized that there was no national public health messaging coming. We were getting messages from our friends, from colleagues. I had pulled my kids out of school and had them start wearing masks really in the beginning of March. And St. Patrick's Day came around and I live in Chicago. St. Patrick's Day is a big day here and all of the bars were full. There was lines around the block and my friends and I were texting saying, what is happening? Why is everybody at the bar? And we started putting things out through social media and we realized we were having a really big impact in the tweets we were putting out. We were putting screenshots of what was happening in Illinois, what was happening across the world. And we were trying to really get people to understand what was coming, what was about to hit our shores and what we needed to do to protect ourselves and our loved ones. And we decided very soon after that, when we realized the impact we were able to have utilizing social media to spread that information, we decided to form the group Impact, the Illinois Medical Professional Action Collaborative Team. And the purpose of the organization was really to amplify the voices of healthcare workers and people on the ground to make sure that evidence-based scientific information was getting out to where it needed to get to our communities, to our colleagues. And I'll talk a little bit about how we did that. But before we talk about the pandemic, I want to go back to 2019, pre-pandemic, when misinformation and disinformation was still a big issue. I don't know how many times I've had people come to me saying, I have a cure for the cancer you're treating this patient with. I don't understand why you're not giving them this natural concoction of things and sending them to a sweat lodge. And I have patients who have done that. I have patients with metastatic cancer who have gone to these, miracle spas or tried a miracle drug and they come back later with their cancer much worse. So misinformation and disinformation in healthcare and in public health messaging has been around for as long as there have been snake oil salesmen. It's been there. The problem now is we have a much faster way to disseminate that information and get it to people very quickly with the rise of social media, the constant connectivity, with breaking news happening every 30 seconds on your TV, with everybody having a smartphone. The ability to get this misinformation and disinformation out there has become so rampant that it's really hard for healthcare professionals to keep up. We actually did a study prior to the pandemic looking at social media and healthcare workers, physicians specifically, who utilize social media for public health messaging. And what we found was that physicians, 1 in 4 physicians reported being harassed on social media, and 1 in 6 women physicians actually reported being sexually harassed on social media. And the things they were getting harassed about: vaccines, gun violence control, gun control, things along those lines. And then also race. Any advocacy work that was relating to public health was a problem. And that's how people were getting attacked. Now, what we've seen throughout this pandemic is, unfortunately, a disease that is impacting every single person across the globe has become so politicized, especially in this country, that it's impossible to have a civil conversation or discourse about something as simple as wearing a mask or getting a vaccine or social distancing or hand sanitizer even, or treatments for COVID-19 have become so political and so polarized that more and more healthcare professionals are not only getting attacked online, it's also now seeping into the way they provide care for patients in real life. We were having a discussion before this panel started where I sometimes am nervous to ask patients their vaccine status because I've been attacked, I've been yelled at, I've been berated, I've been insulted. And that's me as a cancer doctor taking care of our most vulnerable populations. And so I think it's really unfortunate that because things as simple as wearing a mask have become so polarized, and people use that anonymity of social media to really forget that there's a human being behind the messaging that's going out there. And so we're seeing healthcare workers attacked and really destroyed over these types of horrible messages and horrible, really, discussions that are happening, oftentimes in social media, that then trickle into everyday life. So Impact was formed not only to provide a way to get information out there, it was also formed as a way to kind of collaborate and amplify advocacy efforts focused on science and leaving the politics out of it. Science should not be politicized. I mean, most recently, we can talk about the Joe Rogan situation and Spotify and how that's blown up and that's turned into a huge deal, when in actuality, what has happened is we're giving an equal voice and equal platforms to people who are spouting opinions and people who are sharing facts. So I think that right now we're at a point in our history that we need to take a really deep dive and take a deep look into who we are as a country and who we are as a people, and how do we want to be remembered. When this is written in the history books, we're going to know a lot more about COVID in 50, 100 years. When we talk about this pandemic and we talk about how we treated each other and how we thought about taking care of each other, do we want to say that misinformation and disinformation won? Or do we want to say that human kindness and science and evidence and knowledge is what got us through this pandemic as better people than when the pandemic started? Because I think there is a path forward to that. We just need to make sure that this misinformation and disinformation is addressed and appropriately, I don't want to say censored because I don't believe in censoring. I believe in First Amendment rights. But when people are using misinformation to really result in the deaths of thousands of people, I think we need to do something about it. And really, that's the public health message I'm putting out there today and every day, which is your opinions, while they may be founded in your own personal beliefs and views, cannot go against somebody who has science and evidence to back them up. And that is how we should be creating policy. That is how we should be doing public health messaging. We should be really moving things forward with science and evidence and factual information, as opposed to just the person who's the loudest with the largest platform is able to decide how the rest of us have to live our lives. And so you can tell I'm very passionate about this because I care about my patients. I care about my community. I care about my family, and I care about keeping people safe. And I think a big part of how we need to do that is we need to address and really combat the misinformation and disinformation that's literally taking people's lives.
Dr. Jain, I don't think it could be more eloquently or passionately stated, and I appreciate that. And it also speaks to the fact that you had to create an organization to elevate the voice of healthcare providers and scientists above the buzz of the people outside of that realm. Just speaks to the challenges that we're facing when we're thinking about COVID misinformation and disinformation. So thank you for sharing that. And we'll certainly be coming back to ask some questions about your own personal experience with that as well. So last we'll talk with Susan Benesch. She's the founder and director of the Dangerous Speech product. You're a human rights lawyer by trade, and you've developed this to inspire speech that can hopefully not infringe on people's freedom of expression, but still create a safe space for people to discuss these important topics. So, Susan, I'm going to give the floor to you to talk about some of the legal aspects around freedom of speech with regard to misinformation.
Thank you so much. I'm really honored to join all of you medical professionals to whom all of us owe so much. Perhaps more than ever, I feel very conscious that we literally owe you our lives, or owe to you the fact that we've still got them. The Dangerous Speech Project is a research team. We work on any form of human communication that can lower normal social barriers against violence. That isn't quite the same thing as COVID misinformation, of course, but we have also, as you might imagine, found it interesting and necessary to work on other forms of harmful communication. And also there is an enormous overlap between what we call dangerous speech and disinformation. Dangerous speech is nearly always false. We could not, of course, ignore the torrents of misinformation and disinformation. Misinformation generally means false information shared by someone without the intention of misleading someone else. Disinformation is intentionally misleading someone else. The first thing I'd like to point out, I'll talk a little bit about how this information is in fact spreading, especially online, as Dr. Jain mentioned and began to describe. I'll also say something about the capacity, the limited capacity of law and of the rules that the tech companies, internet companies, have made for content moderation, for deciding to what extent they allow that kind of disinformation and misinformation to circulate online, where, exactly as Dr. Jain said, it literally has taken people's lives and is continuing to do so. First of all, very often the very same piece of content, as the tech companies like to call it, can be both dis and misinformation. This is a very important point. Someone might post false information, and in fact they do far too often, but then it spreads so much, often because other people are sharing, forwarding that content, thinking that they are doing a favor to their friends and their families and their colleagues and their acquaintances. In other words, so many people are convinced of these lies, of the false information, that they think they are doing a good thing. So people who are, in their own view, well-intentioned and trying to protect others, sadly and ironically, are one of the main drivers of these dangerous lies online. It is so often misguided good intentions that are in fact doing so much damage. So this is important to remember as we think about how to slow this down or even ideally stop it. You promised that I would talk about law a little bit. At my organization, we are also fervent defenders of freedom of expression. And in fact, in the United States, as you probably know, our First Amendment, our constitutional law, protects freedom of speech even more vigorously than the national law of any other country in the world. It is not only not a crime to say various terrible things, including dangerous lies in the United States. It is often a constitutionally protected right. So we cannot rely on constitutional law or criminal law to stop the spread of COVID disinformation. Then let me say a little bit about the private companies that control online spaces in which so many of us communicate in both directions. In other words, so many of us express ourselves and also receive information and false news, non-information, lies masquerading as information. Companies like Facebook and Twitter and TikTok all have rules that they call variously their community guidelines, or sometimes the rules on what content is permitted and what isn't on a given platform are buried in what's called the terms of service. In any case, they all draw some lines, and they restrict content or speech more than the First Amendment would. And in the beginning of the pandemic, some companies did, under pressure, I'll say, begin to enhance their rules to forbid COVID disinformation. And of course, disinformation about other diseases, but their overwhelming focus was, of course, COVID. Some companies even did some kind of public service announcement kind of messages to try to encourage users to, for example, check the source of information and check the context. Unfortunately, research indicates that those kinds of messages are not generally very effective. And so although I share Dr. Jain's caution about censorship, I must say I agree with, for example, the 500 healthcare professionals who sent a letter to Mark Zuckerberg, the CEO of Facebook, in November, demanding that Facebook take, quote, immediate urgent action to stop the deadly spread of COVID-19 disinformation on the company's platforms. The healthcare professionals demanded that Facebook disclose all data about the scope, reach, and content of this information and of this disinformation and its impact on users for evaluation by independent public health researchers. Unfortunately, the demands in that letter have not been met. Facebook and other companies say that they have made robust efforts to take down disinformation, and undoubtedly they have taken down some. However, they have done nowhere near enough. A study from the Institute for Strategic Dialogue, ISD, found that at least through June of 2021, Facebook failed egregiously to take down all sorts of COVID-19 disinformation, including posts by something that called itself the World Doctors Alliance. Even the name of that organization was, of course, false. This is an anti-vaccine group whose members regularly post utterly false information about COVID-19 and about the vaccines. This group grew dramatically in popularity, and its posts became viral and were not removed from the platform until July of 2021. So unfortunately, we must surmise that the information from just that one group, or the non-information, again, the lies from that one group, will have done significant damage. Our discussion is painfully well timed, given the scandal about Joe Rogan, the most popular podcast producer on TikTok, and TikTok's failure to restrict the circulation of COVID-19 disinformation by Joe Rogan and the people he has been interviewing. I would just say that although healthcare professionals are surely individually and collectively exhausted, and the rest of us can surely do nothing better than to fall on our knees and thank them individually and collectively. I am nonetheless very much struck by the efforts of nurses and doctors like Robin Kogan, like Shikha Jain, pardon me, I think I mispronounced you the first time, to use the authority, the respectability, the credibility that they have, thanks to their work, and also often thanks to their own individual moral standing in communities, to spread the truth. The rest of us can perhaps help by trying to facilitate the amplification of their voices. I'll stop there.
Oh, thank you so much. And I'm going to be certainly coming back to you to talk about some of the points of law, especially in and around how healthcare providers may have an opportunity to protect themselves. But I wanted to start our conversation back with Dr. Jain. Dr. Jain, you mentioned, and I think, this is oftentimes very true of, cancer treatment, but we oftentimes see this in many other, fields of medicine as well, in that, there's lots of misinformation or disinformation around, treatment. And that's been around, for decades. And you mentioned, snake oil salesmen have been, selling their wares for many, many decades. So, the pandemic, however, seems to now have elevated this conversation, particularly around vaccines and around mask wearing. Do you think this is just, is this a question of degree, in just that the volume has been turned up because of the impact of this, pandemic, or is this something entirely new or different that we're seeing?
So it's a great question. And I think it's due to a couple of things. Number one, I think it is partially due to the fact that social media is so widely available and everybody has some type of social media or connectivity account somewhere. But I think that the real reason that the pandemic especially has amplified this is actually something that was also asked in the Q&A, which is science is constantly evolving. When it comes to science and treatments and medicine, we are treating things now that 50 years ago we didn't know how to treat. In cancer care, we have new drugs coming out all the time. We change our standard of care practices regularly based on new science and new data and new evidence coming out. The difference is what's happening during this pandemic is the entire world is watching the scientific process in real time. Normally what happens is, as scientists, as doctors, we learn all this really interesting stuff. We do all these trials, and then we get the treatment to market. And then people say, okay, the doctor's saying I should take this. My nurse is saying I should take this. I'm going to take it. But that's because this is data that was collected a long time ago, or it was collected over a very, clinical trials and all those things were done. People aren't paying attention to them. Like I could probably name 4 very, very big clinical trials in cancer that none of you will have heard of, but every oncologist will have heard of them. But my cancer patients haven't heard of them because they didn't have cancer until they met me, and then they're getting treated, and now they're learning those things. And the stuff that they're learning has already been studied, researched, and I'm providing them with medication, and they can look at the data. What's happened with the pandemic is, I always use the analogy, we're building the plane and flying it at the same time. And a lot of people don't realize that the way scientific discovery happens is science is constantly changing. I've actually heard politicians say, well, isn't it science? Why are the recommendations changing now from a year ago? And literally, that is the point of science. The point of science is, as we learn more, we update our recommendations. I mean, if you think back in the 70s and 80s, we weren't recommending kids be in car seats. There's pictures of kids sitting in the front seat of a car at the age of like 6. You would never do that now in 2022. So I think that the thing that's become so challenging is not only is the information disseminating so widely, the pandemic is impacting everyone. With other medical conditions, that's not the case. You may know somebody who has diabetes, but if you don't have diabetes, or your mom or your dad or your friend doesn't have it, you're not going to know all the diabetes drugs. But this is impacting so many people. And as we learn more, we're updating and changing guidelines. And that's also caused people to mistrust the system because it's become politicized. Because people are saying, oh, well, you said this 6 months ago, and now you're saying this. You're saying that because of, your political beliefs. When in actuality, I am putting information out there and other healthcare workers based on the data we have in the moment, not the data from 6 months ago, because it would be unethical for me to be recommending something now when we know more than we did in December of 2020. So I think that's why a lot of people can't reconcile that concept of, as we learn more, our guidelines are going to change. As the pandemic ebbs and flows, as new variants come, as we get vaccines, as different areas of the country have increased uptake in their vaccine numbers, when all of those things happen, we are going to change guidelines. And it's not because we're making a political statement. It's because we know more now. We're making guidelines based on what is happening in real time. And that, I think, is a big problem. And the third big issue is people think that things like the vaccine were rushed, when in actuality, all of the red tape was just removed. So all of the bureaucratic and nonsense and the payment issues and all the stuff that makes it take so long for clinical trials to happen, those were all removed. What was left was the core values of science. Let's do the best science we can. Let's get these vaccines out as quickly as we can, using all of the very rigorous protocols the FDA, the CDC, all of the regulatory bodies have in place, without all of the extra noise. And so people don't realize that the type of science we practice is often delayed because of all of this red tape. If you remove all of the red tape, look at the miracles we can accomplish. So I'm hopeful the silver lining is we will see all of the extra stuff that we don't need to do, where we can actually get drugs and treatments and vaccines out faster, utilizing the system that we have found to be so effective over the last couple of years.
Yeah, and I think one of our attendees actually asked very much the question that you just answered. I think this was exhausting for healthcare providers as well. I looked back into my, early writings and notes on how we were going to debrief each morning in the emergency department and in the ICU about, COVID. And it was, should we be using ibuprofen? Should we be using ACE inhibitors? Should we be, giving hydroxychloroquine? And how much that has changed over time, and almost on a daily basis. We were saying, okay, well, now use 6 milligrams of dexamethasone. And then a few days later, now let's use 12 twice a day. And so I think it would, it did take even a lot of faith from healthcare providers to say, we just have to trust the data. We have to listen to our scientists. We have to listen to our, what data is developing on a daily basis, because this pandemic is changing on a daily basis. And then we have to, almost roll with the punches. So thank you for so eloquently answering that. Yes, please, Robin.
Yeah, I did want to piggyback on to what Dr. Jain said, because the messaging is really the focus that I have had. How do those messages land? Who are they landing, and how they're being interpreted? What we watched really was, the sausage being made. And if you're in the healthcare industry, you understand. If you have a background in public health and science, you value how the scientific, how that works. That is the beauty of science. We have to keep moving it forward and look at what we learned based on the data, based on the evidence, what we had to change. But how does it land in the public, I think, is really where the messaging failed. And from the beginning, we know that this was a political hot potato. If messages about masks from the beginning were honest, why weren't we wearing masks at the beginning? Probably because we didn't have enough to keep our healthcare workers safe. At the very beginning, why, truths were not really necessarily being told, because science was hijacked by politics from even before COVID was released to the public. And I think that is something That lesson is going to be learned for a very long time. And that political message is reverberating today. It's impacting who is trying to become on your school board, who are your freeholders in your town. I mean, we have to look at what's happening in small towns, in big cities, and across this country, because there are some, in my mind, people who are trying to get into positions of power with an agenda that is not based in science and fact, that is actually pretty dangerous when they want to mandate mask mandates, mandate banning masking. If that's your platform, and this is what's happening in school districts and states all across the country, it is terrifying to think that there are fights over the known mitigation strategies, the only ones that we have in school, and there are fights whether or not to have them present.
Robin, thank you for building on that. And I think this will build on this as well. And this is actually a question from some of your school nursing colleagues. Do you see this having an impact on other vaccines? Is this going to now have further reach into polio, into measles, mumps, rubella?
Well, this is a huge concern because I'll give you a perfect example. In New Jersey, we're one of the few states that requires the flu shot for any child 6 months to 59 months who is in daycare or preschool. Very unusual, based in science, because we know it's our youngest kids that bring the flu home to our oldest family members. So every year, preschool nurses like me are collecting, making sure that our children have their preschool shot, have their flu shot, among many other vaccines that kids need for school. There's 14 childhood illnesses that have been prevented because of, the brilliance of science and vaccine. Are we going to turn that around now and make that the discussion of, you can't tell me what to do with my child's body? I mean, that's the fear, that you hear these discussions out there, and groups they're gelling together. Groups that may never have really intersected before, they're finding that, that Venn diagram, and they're fitting together in a really scary place in the middle. And if it has to do with children's health and vaccines, we should all be very worried about that. And so, yes, I do think that that's something that would be up for grabs. You hear it in states like Ohio, you hear it in Florida, you hear it in Virginia. The don't tell me what to do with my kid movement seems to be proliferating everywhere. And that to me is so very scary. And it is the cause of a lot of the strife that is happening in schools.
Thank you. And Susan, I'm going to get back to you in a moment, but I want to bring us back a little bit to the social media platform. And this is a question both for Dr. Jain and for Robin. How did you first become aware that you were, being targeted on social media? And what can you give us as healthcare providers or even non-healthcare providers as ways to remain vigilant about what people are commenting on our social media and preventing, kind of the negative impact of social media? So I'll give it to Dr. Jain first, and Robin, if you could answer that as well.
So it's funny, as I've gotten more followers, it's harder for me to sometimes know when I'm getting attacked. Like I went to sleep one night and I woke up and my mentions had blown up and I couldn't figure out why. And I was scrolling through and I was like, oh, look, somebody picked up my tweet and decided that they don't like it very much. So I think that, but the challenge on social media is it's anonymous a lot of times, right? A lot of people, there's trolls, there's people putting stuff out there. And sometimes I don't see those negative tweets, which is probably better for my mental health, to be perfectly honest. But I think that, I often become aware because a friend will message me and say, hey, did you see this? Or, hey, be careful, somebody's attacking you. And the scary thing is, I know a lot of people who those attacks have actually gone beyond just the social media space, where their clinical practices have been called, or their boss has been called, or their Google score, what is it? The Google rating or your Yelp reviews go down. And that's really unfortunate that people are utilizing things to attack people's credibility and credentials in their professional life because they don't like what they're saying online. So I think to answer your question, the way I find out is I sometimes see it online, sometimes somebody tells me about it. But the way that I respond, I think, is really the important part of this. At the beginning of the pandemic, I would often respond and I would get into discussions with people, which I know you should never feed the trolls. You're not supposed to respond. But what I often do is I will respond with one factual article. So somebody says masks don't work, and I'll say, I always lead with kindness. I say, thank you so much for reading my tweet. Here's an article that actually shows masks do work, and happy to answer any questions you may have. Usually the person who's trolling me or attacking me will just continue attacking me. They insult my appearance, they insult my credentials, they pick whatever they want, they make stuff up about me, and that's fine. I'm not really responding for them. I'm responding for all of the other people who are going to see the tweets, who are going to see the responses, because I don't want the only narrative out there to be the one that these people are spreading, which is false information. And when things get really heated, so for example, I put out a tweet once at the beginning of the pandemic talking about the perks of working from home because I had an administrative day, I wasn't seeing patients that day, and I'd worn my pants backwards all day, which I didn't realize until the end of my day. And I tweeted, haha, good thing I wasn't out in person. What are some perks of working from home? And a local conservative radio show took up that tweet and started attacking me and saying that I didn't understand what people were suffering through the pandemic and how privileged was I, and said all these awful things. But because of groups like Impact and other organizations, I put it in our little conversation, and I said, hey, look what's happening. And all of a sudden there were hundreds of healthcare providers responding saying, Dr. Jain is on the front line seeing patients. She's trying to add some levity. Today was a hard day for a lot of people. Their numbers are surging. And so I think that it helped because eventually that group stopped attacking me and they went on to someone else. But having that coordinated response and coordinated effort is really helpful. Also, there's groups there's a group called Shots Heard Around the World that has been around since pre-pandemic, where if you're getting attacked or if you're getting doxxed or if you're getting, your professional life is being attacked by COVID-19 or by people who are spreading misinformation, you can actually go to their site and they will help you navigate that. They will help you deal with that situation. There's groups like This Is Our Shot that are out there. So there's places and groups like Holla Back that help and can help you coordinate your response and protect you and figure out ways to help you navigate those situations. But my mantra now, because I'm just tired of dealing with trolls and people attacking me, I have started muting people and blocking people, which I never used to do, but I've started doing it now. I try to avoid an echo chamber, so I don't just mute and block people who don't agree with me. The only people I mute and block are the people who are attacking me. And I had one person tell me they didn't like my eyebrows. So I was like, okay, well, you're not gonna have to see them again because I'm blocking you. So I think it's more just trying to figure out, one, what your own mental health can handle, because we also are having a workforce crisis where healthcare workers are leaving in droves, and all of us are doing this stuff in our free time. And I don't have free time. I've got 3 young kids. So I'm spending an inordinate amount of time doing this stuff online in the community, doing grassroots efforts. And I'm doing that. I'm not getting paid, and I'm doing it outside of my normal clinical job, which is being a doctor taking care of patients. So I think, the next thing that we're going to be really forced to deal with as a society is a huge efflux of healthcare workers, which we're already starting to see. Our healthcare systems are at a breaking point, and our healthcare workers are at a breaking point. And I will tell you, the social media trolling does not help with getting them to continue advocating for evidence and science-based practices, because to be perfectly honest, we're tired.
Right.
Oh, Stephen, I think you're muted still.
Sorry about that. Robin, do you have something to add to that as well?
Yeah, absolutely. So in the school nurse world, there are some private Facebook groups that school nurses have joined to share the things that are happening to them. And that's where some of these stories come from. And what I like to do is reach out and support the nurses who have had attacks. A nurse the other day just shared that a parent, and this happens quite frequently, a parent didn't like, let's say her child had to be quarantined or was sent home for COVID-like symptoms, and she blasted the school nurse all over the school's Facebook page. And these things are just happening over and over and over again. It is demoralizing, and it really makes the school nurse feel like every every decision that is made is now being questioned. And part of that is because of the messaging and the changing guidelines, which we know why those guidelines are changing. But what has not been made clear is from the CDC to the departments of health, why those guidelines are changing. I think the other thing is, when we have individual relationships with people, that's one thing. But when parents or teachers or whoever community member comes at us, it's almost like road rage. There's a sense of anonymity that you can say whatever you want when you're in your car. It feels like that. It feels like people use social media as they would use a car for road rage. And it's hard to combat that. The only way I can think of combating it, and Dr. Jain is much more generous than I was, I do block people. I don't get into any discussion. And I do find Twitter a really comforting place. I know there's a bad side of Twitter, but there's nurse Twitter, there's school nurse Twitter. There's lots of collaboration with physicians and nurses on Twitter. It really is a space to meet people that I would have never met in any other realm because of social media. And for me, it has been a wonderful space to collaborate and do like this. I would have never been asked to do something like this if Stephen, I'm not 100% sure how you found me, Stephen, but it would have never happened had it not been for a social media presence. So I do appreciate the power of social media, but it needs to be regulated. I do believe that. And it needs to be, we all have to take self-responsibility, which people are defining in ways that I would have never imagined even 10 years ago. So I try to say, we care about our own children. Can we care the same for other people's children? Like, I want to get to the level of who are we as a country? And it shows in the way we care or don't care for our most vulnerable, like your patients and our children. So it has been, it's been a journey. And I know the one thing that concerns me every single day, besides keeping our kids safe, is that they're watching us. They're watching what we're doing. They're watching how we're responding. They're watching how we speak to each other. And they're watching what we're not doing. And so that sits really heavy with me every single day.
Well, thank you, Robin. And we are coming close to coming up on the end of our discussion. I want to ask Susan a question first and then give everyone a quick closing opportunity here as well. And Susan, this is going to be a pretty loaded question. And that is there a role for our government to start regulating, what's disseminated about healthcare providers, particularly when it comes down to misinformation or disinformation? And similarly, if there is time for you to answer that, do you see a role in these companies like Spotify, like Facebook, to regulate this outside and just their terms of agreement, which I don't think any of us read?
Stephen, no fair, that's several different enormous questions.
Right.
So I'll do my best and be as quick as I can. Given the structure of US law, particularly constitutional law, that I mentioned briefly before, it would be difficult for, you mentioned the US government, it would be probably Congress that would try to pass a law requiring the tech companies to regulate content in a particular way. The example you gave is very specific. To answer briefly, it's very, very difficult to imagine Congress passing a law that would direct companies like Facebook to regulate content especially in such a granular way as to protect healthcare professionals or to prohibit COVID misinformation. The law would, even if it were possible, and even if Congress would pass it, a law would be written more broadly so that it would be useful even when we get past this pandemic. it would make more sense for it to be more general. Then you asked me about whether the companies can regulate disinformation outside their own rules. Even though almost none of us read their rules, those are their internal quasi laws. Those are the policies, with which they make decisions. And so I don't think it would make sense for them to if what you're imagining is to kind of make another set of rules separate from the ones they've already got. In my view, it would make more sense to amend the rules they have. And some of them have already done some of that, but much, much, much more important, in my opinion, is to enforce those rules more effectively and more consistently. Most of the platforms have got reasonably good rules by now, even specifically regarding disinformation about diseases. Facebook, for example, updated its rules to include disinformation, to permit the company to crack down much more vigorously on disinformation. But as I described before, they have a nice looking rule, but they have really not enforced it sufficiently. So I think that's where they need to make much more effort.
Thank you. I know that was a very tough question to end with, and I appreciate your very cogent response. So I'm going to come back to you. I'm going to give you each just one quick blurb. Something that you're hopeful for in the coming year with regard to this topic, in the the style of wait, don't tell me. You can have it be a news heading, or you can just have it be your own quick blurb. Susan, I'll let you start.
I want to lift up and amplify and sort of riff on something that Dr. Jain said, and it is that when you are responding to content that is false or harmful, you are usually the main audience you have is not the person who posted it or shared it. Bear in mind that there are usually at least dozens and sometimes hundreds or even thousands of other people listening, so that when Dr. Jain, let's say, tweets an article that presents evidence that masks do work, perhaps the person to whom she is directly responding won't pay any attention, but plenty of evidence indicates that many other people are listening, they're reading, they will pay attention. You just don't hear from them because they are, by definition, the ones who are not so extreme and not so loud, but there are far more of those. So take a little bit of heart in that. Quite a lot of people do pay attention to what is true and sensible.
Thank you, Susan. And Robin.
Yeah, so what I'm finding hopeful is that the voice of the community is getting more powerful. And we need to embrace those voices that are that we can bring into the fold in terms of understanding science and explaining why these things happen. What I have seen is that when we have those one-on-one conversations with parents, let's say, who have some vaccine concern or hesitancy, having that discussion one-on-one can change the course of their decision-making. So it is really, it is literally one discussion at a time. And that has been somewhat hopeful since we've had vaccine located clinics in our schools. We have seen an uptick in people choosing to vaccinate their kids. It's very slow, but it at least is a glimmer of hope and a chance to build these relationships that have been there, but we just need to foster them.
Dr. Jain.
So
Your closing comments.
Wow. I mean, that's a lot of pressure. I don't know if I can handle it, Stephen. But so I think that we are at a point now where there are brighter days to come. I mean, we are at a point now 2+ years into this pandemic where we have vaccines. We know masks work. We hopefully will be getting our kids under 5 vaccinated soon. we're at a point where we know a lot more than we did 2+ years ago. And we have tools in our toolkit. We have treatments that we did not have 2+ years ago. So I don't want you to get discouraged. I want you to remember that there's a lot of positive advancements that have happened in the last 2 years. That being said, we need to remember that we need to be kind to each other. Everybody is exhausted, whether you are in the healthcare space or not. This has been a long 2+ years. Remember to lead with kindness. As Robin said so eloquently earlier, our kids are watching, other people are watching. The way we behave, whether it's online or in person, has an impact on everyone. And give people grace, because everybody is tired. So I cut people a lot more slack now than I did probably 2.5 years ago. And that's because I know if I'm feeling exhausted, other people are feeling the same. And I want to end by just saying misinformation and disinformation are not new. They've been there for a long time. It's up to us to continue to work towards addressing the misinformation and disinformation in constructive and positive ways. One person can make a difference. Find a bunch of people who can help you amplify your voice, amplify their voices, find your community, find your team, find people who can help you, because it's going to take all of us to really make an impact. And so don't think that your words are not being heard. Don't think that you don't have an impact. Each of you on this call, anyone who listens to this panel in the future, even just talking to one friend, you might be impacting multiple other people by convincing one person to get a vaccine. So just remember, your voice matters, and you can absolutely have an impact on many more people than you may ever know.
Well, thank you all on our panel today, Dr. Shikha Jain, Robin Kogan, and Susan Benesch, for your passion, your commitment, your expertise. This has been an incredibly important conversation. Thank you all for listening today. We appreciate you having us join us. We know that everyone's time is limited, and that you would spend your time listening to us today is very, very much valued. Make sure to check out our website for other events of this type. Follow us on Twitter and Instagram. There's lots of other programming that we know that you would all enjoy. So thank you again to everybody. This is Stephen Wood signing off for the Petrie-Flom Center. And hopefully you all have a wonderful rest of the day and wonderful weekend to come. Thank you so much, everybody.
Thank you.